For a closer look now at avian flu and other health news, we're joined by infectious diseases specialist Dr. Isaac Bogoch. Good Saturday morning to you. Thank you so much for making some time for us.
Good morning, Hillary. Great to chat.
So, as we just reported, this recent deaths of several birds and skunks in public places from avian flu raising concerns about the possible spread of this virus. Health officials have said that the risk to humans remains low for now anyways, but are urging people to protect their pets. So hoping that we can start there, Dr. Bogoch, is this strain of the virus changing in ways that could maybe impact humans?
So far, it hasn't, and so far, it doesn't appear to be. But I think the key issue here is avian influenza has been around for a long, long time. Certainly this year, we're seeing much more of it. The real concern is with such an impact in bird populations, we see lots of bird die-offs, and then unfortunately you see other mammals who are scavenging and coming into contact with those dead birds, and there's been a significant burden of illness in mammal populations, and you pointed out just earlier several mammals that have been impacted by this. And of course, it's a deadly virus. It kills birds, it kills mammals. The degree of transmission between mammals does not appear to be significant, and the jump between birds to mammals does not appear to be significant at this point in time. But the key here is if there are multiple events, there's always the possibility for the virus to change and more efficiently transmit between mammals, including humans, of course. And this is a deadly virus. We know that of all the known cases in humans, over 50% of them have resulted in death. So this is something that we obviously have to watch and be mindful of and be careful of. And from a very practical standpoint, if people see a dead bird or a sick bird or a sick animal, don't touch it, don't go near it, and of course, keep your pet away from it.
Yeah, keep your pet away from it as well. So good advice there. I want to ask you about this other story, this drug-resistant yeast fungus that has now been detected in more than 30 countries. U.S. Centers for Disease Control and Prevention sounding the alarm over the growing threat of this potentially deadly fungus. We've seen cases nearly double between 2020 and 2021. Early figures also showing that for last year, there was a jump to at least 2,300 cases as well. So what do we know about this yeast fungus, and what sort of illness does it cause?
This is called Candida auris. This is a very nasty fungal infection. It's not exclusively, but primarily found in healthcare settings. Most infections are in healthcare settings. In 2019, the United States reported just over 400 infections, and then in 2021, they noted just over 1,400 infections. So there's more of it around. It's got a wider geographic spread, and the key. It's also here in Canada too. We've reported just under 50 infections as of 2021. So there's certainly more of this. But again, this really preys on the most vulnerable individuals, typically in hospitalized or intensive care unit settings, and typically those who are immunocompromised, but it's deadly. And one of the issues with this infection is that there are very few antifungal drugs that work for it. And that's why they're sounding the alarm. There's more of it around. It's in a wider geographic space, and it's very, very difficult to treat because of the drug resistance associated with it. And of course, it can be deadly. While there certainly is more of it around, that doesn't mean there's a lot of it around. And for otherwise healthy people walking around in the community, this doesn't really pose any significant threat. But in healthcare settings, I can assure you that every healthcare setting is screening for this and is doing surveillance for this, and would jump on cases very, very quickly to ensure that there's no spread, especially among medically vulnerable people in those healthcare settings.
Do we have any sense, Dr. Bogoch, of why it is so drug resistant, and whether we might see more of that type of thing in the future?
Yeah, I mean, we are in an era now of there's a true global health emergency of antimicrobial resistance, and that doesn't just mean against bacterial infections, but also fungal infections such as this. The problem is getting worse, not better. There's various organisms around the world where we have fewer and fewer options to treat. Alarms have been raised in terms of better stewardship using our antimicrobial agents, not just in healthcare settings, but also in veterinary settings and in agricultural and farm settings as well. We have to use our drugs wisely. They're a very precious resource. We have to track the spread of antimicrobial resistance. It truly kills millions of people per year on the planet, and the problem is getting worse, not better. So I know we're talking about a fungal infection now, but the problem is actually much larger than that.
Okay, for this morning, we're going to leave it there. But as you say, because this is a growing problem, I suspect we will be talking about this in the future. But for this morning, Dr. Bogoch, thank you so much.
My pleasure.